we have Professor Macas, anesthesiologist, Lithuania University of Health Science. So please, Professor, does it matter?
Thank you, Algirdas. It's very warm to congratulate all of you. And of course, this is the last topic for this day. And as you understand, I am not an oncologist or urologist, but last year we discussed about COVID-19 and different things. This year we will move on long COVID problem, but actually we will shift from just COVID-19 and a little bit later about what we anesthesiologists and intensive care doctors face with long COVID. We will not discuss about fatigue, dizziness, and other things. Even we will not discuss about lung damage after COVID. By the way, lung damages, even very serious damages, after 1 year, we can say that even very serious damages of the lungs, our lungs, they have good chance to recover, even if the patient has just 10 to 15 or even 5% of his native lungs. We should go further, and the Lithuanian and Baltic states and the pulmonologists around the world, they really are optimistic, even in very severe cases. But then we speak about urogenital system. We have to notice not one but several things. First of all, we should speak about some. Just a second. Yes, it goes. And first of all, we have to speak about damage which we get to the kidney during the acute phase of the COVID. And this is not optimistic if it is severe, but we will discuss a little bit later. Then we face abdominal pain, which might be acute pain. Then it's you can find very, let's say, reasonable and clear causes of this pain. But some of these pains, they have a trend to become a chronic pain. And this chronic pain is a really big problem for these patients. Of course, we should discuss, this is not my topic and you experts in this field, but we have to discuss at least a little bit about COVID-19 and man fertility. And last, my presentation, the point of my last slides will be about testicular pain and not optimistic case report, which you will see at the end of my presentation. So what is very good that we shifted from alpha, beta, and delta subtypes of COVID-19, and now we are in Omicron, and I think we are in quite optimistic position. And if we speak about mortality question, this will be in favor for all humanity. But when we speak about COVID-19 and long COVID outcomes, we still have to be very precise. So we go further with my presentation. And what is very important, that virus-induced ACE2 receptors, they worsen the viral pathogenicity, and this leads to organ damage. What we know very well, that ACE2 receptors, they are really expressed in urogenital system, and not only kidneys are in this field. So then we go further. We have to understand that ACE2 receptors, they are placed in different parts of urogenital system. But what is very, let's say, disastrous, then we have renal damage in acute phase. As anesthesiologists and intensive care doctors, we know that if the patient has a lung injury, if he is intubated on a ventilator and he gets acute injury of kidney, he is in very poor or let's say very bad prognosis. We know if the patient, then we got type A or alpha or beta of COVID-19, we knew that if the patient is intubated and he has no acute kidney injury, so he has a success at least of 60%, at least of 60% if everything goes smoothly. But if he has an injury of the kidney, so he has a success maybe less than 10%. So it's very important to notice. As we go further, the acute viral kidney injury might be direct or indirect. This indirect kidney injury you can see on right side of this slide, and you can easily find the reasonable answers like fever, vomiting, diarrhea. We got a fluid loss and then volume depletion, so we get acute kidney injury. But we also have to know that even mechanical ventilation, nephrotoxins, and sepsis, secondary sepsis, leads to acute kidney injury, and this is not also optimistic and actually quite pessimistic scenario. What is also very important to notice, what we saw, and this is very well known for, let's say, 50 or even 70 years, that then we speak about lung injury. So viral pneumonia is associated not with alveolar damage, but mainly it's associated with around vascular thrombosis. So this vascular thrombosis is very well known in lung questions. But then we go and when we discuss about kidney damage is also one of the possible ways why kidney might be damaged. And look, what are the differences? Then we speak about sepsis-induced coagulopathy. We have a platelet count. It's in sepsis, it will be decreased in most patients, but in COVID-19, it will be normal in most patients and might be even elevated. When we speak about fibrinogen, so in sepsis-induced patients, it will be normal or decreased, but then we speak about COVID-19 patients, we will have severely increased levels of fibrinogen. So this is a clear case of 28 years old lady which had severe acute pain. As you can see on the right side, the patient was afebrile. She was tachycardic to up to 112 beats per minute. She had quite normal blood pressure and normal oxygen saturation. She was a COVID-19 positive. But you can see we do not speak about lung damage in her case, but we see that she has slightly elevated creatinine levels, and not slightly, but the increasing creatinine levels. We have, you will see a little bit later, not that disastrous LDH and D dimers, they are not so elevated. So the prognosis of that lady, if we speak about COVID-19 infection, is very good. But we still have quite bad situation with acute pain, which is induced by this infection. And here you can see, we see the hypodensity in CT scans, and we see multiple infarctions of the kidneys, not in one, but in both kidneys. So this acute pain problems which you can face even not in urology department, but somewhere in emergency room. They might be associated with COVID-19 infection. And what was given, what is very important, what was very important to know, that it was given for this lady enoxaparin, was given twice daily. This is low molecular weight heparin. And what is very important, these things are quite enough if we speak about COVID-19 infection in general. And later on, you can see this lady was shifted to aspirin and rivaroxaban, which is peroral anticoagulant. And what we also, as anesthesiologists and intensive care doctors, see that rivaroxaban or low molecular weight heparins, they really decrease D dimer levels. They even decrease CRP levels in these patients who even do not take antibiotics. So what we also have go back and to remind each other that viral infection or viral damage of different organs is associated with thrombosis, not with direct injury of endothelial cells and other parts of the organ tissues. So thrombosis is really big problem in all COVID-19 and other viral infections. So then we speak about COVID-19 and man fertility. We also know, we have to know that COVID-19 infection interferes with protective function of ACE2 receptors. That is why we have a disrupt spermatogenesis and testicular function. The testicular samples of infertile men with impaired spermatogenesis expressed with ACE2 mRNA at lower concentrations than samples with full spermatogenesis. So we should notice. And not only this, but also what we have to know that blood test is a barrier. We have a breakdown due to COVID-19. And this is also a huge problem and one of the reasons which are associated with COVID-19 damage. So when we go further, we see that in COVID-19 patients, the quality of semen of these recovered COVID-19 males were within the lower reference limits. And total, if we speak about total count, you can see that these with recovered function and with recovered disease, they had a significantly lower levels of total count and total motility. The same is then we speak about the severity of COVID-19 infection. And what is also interesting, that even recovery, the short and long-term recovery, we can't be so optimistic. So this might be the reason that COVID-19 potentiates or conditions quite long reduction of the man semen characteristics. So then we go further. We also have to notice that COVID-19 induces the imbalance of hormonal imbalance, and this is of course quite well known, but we have to notice that not only in other viral infections, but COVID-19 infection, this really affects. and this is very easily explained. The interstitial Leydig cells are responsible for testosterone production under the regulation of luteinizing hormone. And we have a negative feedback between the testosterone in testes and the luteinizing hormone in the pituitary. So the ratio then it changes. Ratio are more likely to be caused by testis dysfunctions, such as the possible damage of Leydig cells. And my last case, and the last part of my presentation, this is what we have in anesthesiology and intensive care, these sad stories. These stories we had at the very beginning in alpha, beta, and of course, delta subtype of the virus. Here you can see 43 years old man with medical history of type 1 diabetes. That's of course very important concomitant disease or comorbidity, and actually he had no other clear diseases. So you can see patient has slowly increasing dyspnea, but what he was complaining? He was complaining about acute testicular pain. So this is quite important. At the very beginning, what also we have to mention that this patient was treated quite aggressively. It was administered tocilizumab, which we also use in some selected cases. And as we say, 50 to 50, it helps. Sometimes it helps very well, but sometimes no. You can see at the very beginning, he had 15 liters of oxygen, and that was quite enough. But later he was deteriorating. So at the very beginning, CT scan, due to this pain of testicle, show that these testicles are regular and symmetrical, but have enhancement of the testis, epididymis, testicular artery, and pampiniform plexus. The same or almost the same changes in the ultrasound. But the problem was evaluating. Here you can see the CT scan, but the problem was developing further, and the situation was deteriorating. He had a severe tachypnea, he had a severe dyspnea. He was transferred to ICU for non-invasive strategies, but later patient was intubated and mechanically ventilated. Unfortunately, he had a severe cardiogenic shock. Of course, he had later irreversible cardiogenic shock due to myocarditis of unknown origin. Actually, this is we keep as a virus-induced myocarditis. But what was also very bad or in poor prognosis for this patient, he had a multi-organ dysfunction, including acute kidney injury. So then it was the autopsy performed. No very specific morphological changes were found. So in conclusion, COVID-19 infection and long COVID as a disease might be associated with early kidney function damage and impairment, leading to poor outcomes. Unclear also, we might have unclear abdominal pain, late chronic pain or onset of chronic pain, and of course impaired in fertility and problems with male fertility. Thank you for your attention. I think we will, all of us, we will have quite big problems next several years with long COVID disease. As I said, not only with injury of lungs, but not only the mood changes, not only the fatigue questions, dizziness, insomnia, and anosmia, which lasts for not 2 or 3, but 6 months or even 1 year and even more. But also we have to think about damage of urogenital system. Thank you for your attention.
Thank you very much. Thank you very much, Professor. Thank you. So, answering into your question, does it matter? Does this matter? So, yes, it still
Yes, it's
matter,
natural.
and this is big problem, big challenges. Uh, so, any questions for the audience, for the virtual audience?
You know what I think, what would be important to say, that I think if we speak about in hospital problems, we will have not so many, but in outpatient clinics we will have chronic pain problems. We will have chronic renal impairment or insufficiency problems that will go, of course, to neurologist. And for you, I think, for urologist and an endocrinologist, the question with fertility problems
Fertility.
will be quite actual.
Thank you again. Thank you for the nice presentation.